Okay, this is the first of a series of several videos regarding the hip joint. In this video, I'm just going to kind of make some general comments about the hip joint, especially comparing it to the shoulder joint. So both the hip and the shoulder are ball and socket joints, and they both have movements in all three planes. So flexion and extension in the sagittal plane, ab and adduction in the frontal plane, and internal and external rotation in the horizontal or transverse plane. They both quite obviously, have a ball and have a socket, ball and socket. In both cases, they have labrums that kind of come out of the socket parts. You have a glenoid labrum, and you also have an acetabulum labrum. They both have ligaments that help support their structure. And then they also, kind of as the most proximal joints in the upper and lower extremity, respectively, kind of set the tone for the entire extremity. So a lot of things that you're dealing with the upper extremity come back to the shoulder. And in a similar way, a lot of things that you deal with the lower extremity eventually come back to the hip. So they're kind of like the most important parts of their respective extremities. But in many ways, they're very different. So one of the things we talked about with the shoulder is how it's really, especially, first off, it's really three joints, right? But just talking about focusing on the glenohumeral joint, how it's really fundamentally an unstable joint. And that's partly by design, because that instability allows us tremendous mobility. And the main purpose of the shoulder is to place your hand in space. And in general, the majority of movements of the upper extremity are open chain movement. That is where the distal end is not fixed because you're moving it around. And in general, it's a non-weight bearing joint. So it's not built for stability, it's built for mobility. And really what stability there is there really comes from the muscles themselves. The hip is very different. The hip's primary role is to support your body weight. So it's a weight bearing joint. And while we do have a lot of open chain movement at the hip, we have a lot of closed chain movement as well. It's equally as important. And the ligaments of the hip are also quite different. So whereas the ligaments of the shoulder, they play a role, and you'll notice if you tear them, the ligaments of the hip are absolutely the strongest in the body. So that makes them really important. So I just want to talk about a few of the key bony landmarks of the pelvis and the femur. So typically this is a right pelvis and a right femur. So for that pelvis, you have the ilium, which is kind of this part. You have the pubis, which is kind of the part in the middle, and then you have the ischium, which is kind of the part in the back. For the ilium, you have the iliac crest. You have the anterior superior and anterior inferior iliac spines. You have the posterior superior and posterior inferior iliac spines. You have what are called the gluteal lines. That's kind of the posterior, and then the anterior and the inferior. There's no superior for reasons I can't explain to you. And then for the pubic area, you have superior pubic ramus and the inferior pubic ramus. You have and then for the ischium part, kind of this bottom part, you have the ischial tuberosity, which is a key part for a lot of the hamstring muscles, and you have the ischial spine. That's a couple of the key markers on the pelvis. So the femur goes into the pelvis like that. That's the acetabulum. So the femur, there's the head of the femur, right? Just like you have the head of the humerus. You have the shaft. You have the intertrochanteric line, which is kind of this sort of imaginary line in here. You have the greater trochanter and the lesser trochanter. And then on the kind of the medial part, you might say the fovea is that little pit. You have the intertrochanteric fossa, which is kind of in here. On the posterior side, you have the intertrochanteric crest, which is over here. You have the quadrate tubercle on the intertrochanteric crest. And then you have the linea aspera, which is kind of this raised section that runs down the shaft. Proximally, it's going to flare out into two parts. The pectineal line, or the spiral line as it's called in some texts, and then the gluteal tuberosity, which is up here, and that's where the gluteus maximus is going to attach from. And then you have the medial and lateral lips of the linea aspera, which is an attachment spot for a lot of the adductor muscles. And then it's going to flare out into the supracondylar lines, just like you had at the humerus. So you have a medial and a lateral supracondylar line. And then you have the condyles, kind of the knobby guys at the end. You have the epicondyles, which are the little parts that stick out. There's an adductor tubercle in here, and then intercondylar notch is just in between the condyles. So those are some of the key parts of the femur and the pelvis. So coming back to the ligaments of the hip, you have the iliofemoral ligament, the pubofemoral ligament, and the ischiofemoral ligament. And they're pretty much named for where they pretty much are where they're named. So the iliofemoral ligament is also known as the Y ligament, and it's going to sort of come down here from kind of the ilium and kind of the interior part of the acetabulum and come around the head of the femur like this, kind of in two bundles. And then you have the pubofemoral ligament. It's going to come more from the pubis and kind of the inferior part of the acetabulum, and that's going to come down and actually blend into the medial part of the iliofemoral ligament. And then the ischiofemoral ligament is going to come from back in here from the ischium. It actually has three bundles, some of which come more in front and some of which kind of wrap around back in here. All three ligaments are going to become tight, at least partially tight, on full extension. And then, so what at the hip, the closed pack position of the hip is actually not where the joint surfaces are maximally congruent, which is where we've traditionally defined it, but where the ligaments are maximally tight. And so for the hip, that's going to be full extension, about 20 degrees of extension, a little bit of internal rotation, and a little bit of abduction, abduction. And again, that's not where the joint surfaces are maximally congruent, that's where the ligaments are maximally tight. And those are some comments on the hip joint.